Today on Government Matters, one of the biggest healthcare and IT projects in government hits the pause button. The acting Deputy Secretary of Veterans Affairs tells you what it'll take to start it up again. A deadline looms for every agency to go digital, and the pandemic is no excuse. To make that deadline, a 7-year plan at the National Archives is ready for prime time. And the number one story of the week, the CDC says agencies can mandate COVID tests when employees come back to the office. Can the agencies mandate shots too? Government Matters starts right now.
From Washington, D.C. and around the world, this is Government Matters with Francis Rose.
Thanks for watching the weekend edition of Government Matters, the only show covering the latest news, trends, and topics that matter to the business of government. I'm your host, Francis Rose. The Electronic Health Records Project at the Department of Veterans Affairs is on hold as the Secretary of VA, Dennis McDonough, conducts a review of the program. Dr. Carolyn Clancy, the acting Deputy Secretary of VA, told the House Veterans Affairs Technology Modernization Subcommittee this week VA won't roll out the EHR at new locations until the review's complete and Congress can see what the agency found. Dr. Clancy's my guest to talk about the program and the review. Dr. Clancy, welcome. Thanks for joining me today. What exactly are you reviewing at VA about the EHR program?
So we are reviewing all aspects of the program. First, it's important, I think, for listeners to know that we went live during a pandemic in October of 2020, not for the faint of heart. It is my understanding that some other implementations of electronic records were postponed altogether, but we did not do that. And implementing an electronic health record any place is not for the faint of heart. It is challenging. It makes you rethink everything you do all day. And we encountered some challenges, which is not remotely surprising. But we were concerned when, after a number of weeks, productivity in a number of areas had still not returned to anything like a normal level. And we thought it was very important to investigate. So 3 executives from the Veterans Health Administration went out for a very intensive 2 to 3 day visit and came back with a report. And based on that report, we thought it was very important, to work very hard with our colleagues in Spokane to help them solve their issues, but also to step back and say, how do we make sure that all components of this massive project, which is hugely important and very, very important to veterans, and I would argue to American healthcare, that we're now going to be joining and creating one seamless lifetime record for veterans from the time they start as active duty service members to when they become veterans. That is going to be just a huge undertaking, and I think will position us well to lead in American healthcare.
You referenced the challenges that Mann Grandstaff ran into in implementing this. You're one of the witnesses at the hearing that I referenced a moment ago said VA employees in Spokane raised a total of 247 patient safety concerns since the EHR went live last October. Did you have a context for what you expected for the potential challenges that existed either inside VA, or did the vendor provide you any kind of guidance? Here are the potential pitfalls we could run into as we roll this out, Dr. Clancy.
Well, that has been a focus of ongoing conversation and frankly has become something of understood common wisdom, if you will, across healthcare. In general, when you have to learn a new system, you expect drops in productivity, right? Because you've got to think about every step, particularly many steps that used to be sort of autopilot. VA has been working very hard on this for the past several years, literally looking at all of our workflows so that we would be prepared. But even being prepared going in does not mean you're not going to have challenges. We also hit some challenges with training induced by the pandemic. So, for example, some of the training that Cerner would provide is what is called at the elbow support. Well, you can't do that if you're social distancing and so forth. So based on this, we actually created a variety of tiger teams that are working on clinical workflow optimization. This is not a technical issue, right? This is how healthcare is provided. an EHR, IT in general, can enable and empower that work, but actually it's about the people part. And that's where we've been focusing a lot of our attention at that facility.
The team that you referenced a moment ago, Dr. Clancy, that went out and looked firsthand at what was going on there, when they brought back their findings and prepared that report, what was the genesis of that? Was that, no pun intended, was that the impetus for this review, looking at that material and saying we need to take a break and really try to solve some of these problems before we roll it out other places?
That was an important motivating factor. I wouldn't say it was the only one. Before he was confirmed, Secretary McDonough actually spoke to leaders of some large health systems that had also implemented Cerner. And at this point in time, we thought it was a very good idea to step back and say, do we have the governance right? Do we have the decision-making right? Do we have the right metrics in place for evaluating success? So we've got about 8 work streams moving, and people are working very, very hard. What we also saw in Spokane that I think is really, really important was how proud and excited our colleagues were to be first, and how much they wanted to get it right so that they could then go on to help their colleagues in Columbus, Ohio, and subsequent sites that will deploy. And that, to me, was the most inspiring part of that report.
We have about a minute left, Dr. Clancy. The Defense Department, the military health system, is moving forward with its expansion of its Cerner system. Do you have a sense of what the differences and similarities are that are allowing the Defense Department to continue while you're on this pause?
Well, it's important to know that they started about 2 or 3 years before we did, and we have wasted no effort whatsoever in learning all of the lessons that they've learned. So they've been and will continue to be vital partners in this effort.
Dr. Carolyn Clancy, thank you very much for joining me today. I appreciate your time.
Thank you.
Up next, the path to paperless records at the National Archives. Straight ahead on Government Matters, the coming deadline to go digital. You're watching 7 News. Welcome back. The National Archives and Records Administration is supposed to stop accepting paper records from agencies by the end of 2022. The agency, though, is taking another look at that goal after the pandemic put digitization work on hold at some agencies. Sheena Burrell's the Deputy Chief Information Officer at NARA. Sheena, welcome. Thanks for coming on the program. What are you looking at both internally and externally in this goal to stop taking paper records by the end of next year?
Thank you. Thank you so much for having me. NARA is continuing to work with the other agencies to meet the goal through our annual records management process. From a technology perspective, NARA CIO's office has worked with our current cloud service provider, Amazon Web Services, or AWS, to determine the potential path forward for AWS to AWS transfers. In addition, we're also thinking through transfers with other cloud service providers to AWS. I think the biggest impact on agencies right now is kind of what you said, is the ability to digitize those records that are not already electronic. This is an area where the pandemic has had a significant impact.
Has most of the impact been at the agencies, or has most of the impact been within NARA, or is it kind of a combination of both, Sheena?
I actually think it's a combination of both. This pandemic has really been hard for all of us, I mean, personally and professionally. From a records management perspective, we know, for example, that the closure of NARA's federal record centers or reduced services has had an impact on fulfilling the Freedom of Information Act requests, providing services to the public and veterans. In addition, COVID-19 has impacted our records management operations, including scheduling records and digitization projects, to name a few. However, if there's one thing we've learned during COVID, is that agencies have genuinely recognized that electronic government is not optional, it's essential. Still, before, during, and after COVID, our message is the same, that we're committed to the modernization for the good of the federal government and for our customers. And we inside of NARA are going to continue to build upon the foundation laid by the Obama administration to help transition each of the agencies to a fully electronic government.
Sheena, Federal News Network reports 4 federal record centers are still closed, and the remaining centers are either in phase 1 or phase 2 of reopening. What does that look like as far as potentially pushing your deadline? Is that something that you're considering right now, or are you aiming now more toward how do we catch up and make the deadline of the end of next year?
I think there is multiple things that we're doing. We are monitoring COVID-19 situations in all areas of the country. We have conversations constantly about meeting the goal, what we can do from a deadline perspective. We are trying to catch up, but we also are trying to work on just different conversations with OMB to help see if there's going to be any changes to that joint memo. We haven't had those conversations yet with OMB, but we do expect them to happen.
You mentioned a moment ago people are understanding as a result of the pandemic that digital government isn't optional. How has that manifested itself in the way that the agencies deliver whatever it is they're delivering to you? Are they trying to move more quickly? Are they doing their internal digitization and transformation efforts more quickly? What are you seeing as a result of that, Sheena?
I actually don't know if we're seeing any more digitization happen. We are trying to digitize as much as possible. We're working with other federal record centers. We're working with the VA to do some digitization efforts with them. But honestly, what we're seeing is we're waiting for information from our annual requests from the agencies. Once we get that feedback, then we can really see what position the agencies are in to actually meet that request.
What have been some of the most difficult challenges the pandemic's presented inside NARA? Is it just access to facilities and people working remotely and that dispersal of work, or is there some other thing that has affected the agency?
I think it is the access to the facilities. In some of these locations, as you mentioned, we're in phase 1 or phase 2, but some areas of the country, we're not actually in the buildings at all. So actually being able to come into the buildings and digitize those records is a challenge. And that's some of the challenges that we're trying to meet today. And we're putting different processes in place in order to streamline our work process and to reduce the technician to technician contact with the COVID-19 6 feet apart kind of standards. So those are some of the things that we're challenged with right now, but those are things that we're working to overcome.
So it sounds like maybe the challenge there is just whatever's happening on the ground in the areas of each of those record centers to determine how soon you can get people back, and then I guess also how quickly folks can get vaccinated and feel comfortable and confident coming back to work. Is that a fair read?
That is a fair read. That's absolutely right.
What are you able in that context then to set a timeline, Sheena, or is this just dependent on what the events on the ground are around each of those record centers?
I think that it depends on not only our record centers, but what the other agencies are able to do on their end. I think the biggest part for the agencies themselves is the proper management of all records electronically, including digitization of legacy records with the appropriate metadata according to our standards. I think that's the most important aspect of federal government actually reaching this goal. While we do need to have open record centers to help with FOIA requests and actually being able to digitize records, I think that there's some work on the agency's part as well.
Sheena Burrell, thanks very much for joining me. It's great to have you back.
Thank you so much. Thank you for having me.
Up next, the #1 story of the week. Your agency could make you take a COVID test before you come back to the office. Straight ahead on Government Matters, what your agency can and can't do as it reopens. You're watching 7 News. Welcome back. Now, the #1 story of the week. The Centers for Disease Control and Prevention says federal agencies can mandate COVID-19 tests for their employees as they come back to the office. But the CDC's website says the government doesn't mandate vaccines. Jerry Buckholtz is former Chief Human Capital Officer at NASA. She's strategic advisor at the Charles F. Bolden Group. Dan Meyer is managing partner at Tully Rinke. Friends, welcome. Thanks for coming on the program. Jerry, I start with you. What should employees expect, and what should they expect to hear from their agencies as they start to come back to the office?
I think it's really important that plans are developed that include a comprehensive communication strategy, and that those are developed in partnership with agencies' labor partners. Now is a really great time to enlist your labor partners to help you with this. It is a big challenge. There is no one on the planet that has expertise in reconstituting the U.S. federal government following a worldwide pandemic. There are going to be missteps. There are going to need to be adjustments. So my bottom line advice is remain flexible.
Dan, welcome. Thanks for coming on the program. I note that the CDC's website says that it does not mandate, the government doesn't mandate vaccines for employees. A cynic this week said to me, yet. Can the government at some point in some function or other, or in all functions, mandate its employees to have vaccines before they show up for work?
Okay, so let's keep some things in separate boxes here. There's vaccination and there's testing, two very different worlds. It's pretty clear on testing that can be required in the workplace, but it is subject to the Rehabilitation Act, the Civil Rights Act, the EEOC regulations. So somebody with a COVID condition is protected, and you need to make reasonable accommodations for those individuals. And that's exactly why you need to have the communications plan that Jerry spoke of, and how you have to map this out ahead of time. How do you deal with the information, both in terms of what the employee receives, how do you protect their private medical information once you collect it, and how do you convey to the employee that there is the ability to get a reasonable accommodation if they have a condition. That's all testing. As far as the vaccine, remember, this was rolled out as a experimental process. We all just got jabbed, or many of us just got jabbed twice, basically in trusting authority that there wouldn't be a problem. So that really limits the requirement to have a vaccine. This is not like the smallpox vaccine used to be for schools. Back in the day, before you showed up, first grade, your mother took you in to get jabbed because that's what was required, because that was a thoroughly tested and vetted vaccine. We pushed this one out in record time. So until those studies show that this is as a stable vaccination regime as the ones we're all familiar with from our youth, the requirement is not going to be there. And but you have to keep testing and vaccination separate. The rules are pretty clear that they can be tested, but you can't exclude somebody from the workplace once you have that knowledge. And then the other thing is that the Biden administration has been very clear that they want to work to make sure people are accommodated. And so managers and supervisors and leadership should be flexible, use teleworking where it's required, and communicate and work with employees to win over their partnership in getting ourselves out of this pandemic.
Dan, just very quickly, is the recourse path that employees have if they think somebody at their agency hasn't acted correctly about the return to work the same as for other issues?
Yes, there's been no special rules for federal employment law on the pandemic. We're working within the EEOC, Department of Labor structure. If an employee has an adverse action taken against them, that triggers a response. In the response, lawyers armor up and come in with the Civil Rights Act, Title V provisions. The Rehabilitation Act of 1973 is really important in this case. So it's the exact same process that the employees have known for the past 20, 30 years.
Jerry, where do you see the biggest potential for an agency to make a misstep, as you alluded earlier? And every other expert that I've talked to has said there will be issues. I don't suppose that they'll be intentional. I think they'll be all accidental. But what do agencies do to try to mitigate those mistakes as much as possible?
I think there are two things agencies need to focus on. The first is phased implementation, focusing first on those employees that must be physically on work site in order to do their jobs, because, for example, they work almost exclusively with classified material. The second would be groups of people that have significant interaction with the public, where they may be exposed or they may expose others. So setting up an implementation schedule that allows you to do smaller groups of people at a time and add people in as you have greater expertise. The other thing is, this is not unlike restarting the federal government after the big shutdown. We've got groups of people who have been coming in every single day during the pandemic. We have groups of people who have been working virtually the entire pandemic. We have groups of people who've been on emergency leave. You need a strategy for each three of those groups, and you need a plan to glide them back together into a single workforce. And then finally, as I always say, every opportunity I have, focus on virtual work. You should have a plan to extend your virtual work capabilities through at least the end of FY 2020.
Very quickly, Jerry, what do you see as the long-term changes coming to remote work as a result of this? Is it here to stay finally?
It is here to stay finally. We were always going to this place. We were going to get here probably in about 10 years. We've had 10 years of evolution in 12 months. It's been a big shock to the system, but one that was going to happen anyway. So just embrace this and consider this a jumping off point and expand your virtual work capabilities for the benefit of your employees and also for the benefit of the citizens you serve.
Dan, 20 seconds. Where's the biggest potential for an agency to go wrong in dealing with its employees coming back?
It's right what Jerry said. It's on the communications end. I would imagine the bulk of complaints that will emanate from this process of starting back up again will come from poor communication and the inability of leadership to bring their team on board with what is going to be a massive effort. This is exactly what Jerry said. It's like restaffing after the government shutdown. Dan
Meyer, Jerry Buchholz, thanks very much for joining me. Appreciate your time. Don't forget, if you miss an episode of Government Matters, it's on our website, govmatters.tv, and you get a preview of every show when you sign up for our daily program guide. You just text Gov Matters to 58671. Back in 2 minutes. That's the latest from Washington. Join me weeknights at 8 and 11 on WJLA 24/7 News, and next Sunday morning at 10:30 on 7 News to stay plugged in on issues that matter to the business of government. Thanks for watching. I'm Francis Rose.